There's something that many men rarely admit, even well into their 60s, the quiet disappointment they feel when their bodies don't respond the way they used to. I remember a patient of mine, Edward, 68 years old. He was a strong man full of life and energy. But in our first consultation, he sat in silence for a long while before leaning in and softly asking, "Doctor, is there a way I can still feel like?" A man I knew exactly what he meant without him needing to explain further. Because when we talk about erections, we're not just talking about a biological reflex. We're talking about something deeper: dignity, confidence, self-respect, and the ability to truly connect with your partner. Over the past 2 decades, I've dedicated my work to studying male sexual function in older adults. And I want to tell you, as a friend and as a woman who understands men's bodies from a medical perspective, that there are many natural ways to restore that vitality. You don't have to rush to expensive prescriptions. You don't have to feel like you're past your prime just because of your age. What you truly need is knowledge and consistency. Let me begin with something simple: your pelvic floor muscles. These small, often overlooked muscles located at the base of the pelvis play a crucial role in achieving and maintaining erections. When blood flows from the internal iliac artery into the penis, these muscles act like a pump to trap that blood in the erectile tissues, helping you stay firm. When those muscles weaken, the blood leaks out too soon, resulting in weak or short-lived erections. One of the easiest exercises I teach my patients is this. The next time you urinate, try to stop the flow midway. The muscles you use to do that, those are your pelvic floor muscles. By contracting and holding them for 5 seconds, then relaxing, repeating this for 10 reps, 2 to 3 sets a day, you'll start to see real change. Many men begin to notice improvements in just 6 weeks. Not only will you have better control during intimacy, but you'll also feel that powerful sense of ownership over your body again. But that's just the beginning. Because sexual restoration requires more than just muscle exercise, it requires a comprehensive, holistic approach that combines biology, physical therapy, and even emotional healing. One of the most effective tools I recommend is the penis vacuum pump. This device uses negative pressure to draw blood into the penis, naturally inducing an erection. Think of it as a form of workout for your penile blood vessels, training them to function better. Used properly, around 10 to 15 minutes per session, 2 to 3 times a week, it can bring about a noticeable difference. I've seen men come alive again, not because of a pill, but because they witnessed their own bodies respond. In cases such as post-prostate surgery, or where medication alone wasn't working, vacuum therapy became a lifesaver. I remember one 74-year-old man who, after 4 months of consistent practice, walked into my clinic beaming. "Thank you, doctor," he said. "But most of all, thank me for not giving up." And you know what? That's where it all begins, with a commitment. And your journey, dear reader, is only just beginning. I'll never forget a man named Michael, 63 years old, retired, living with his wife in the suburbs of Missouri. He had a steady stride, but carried a heaviness that became evident as he entered my office. After a while he sighed and said, "Doctor, every time I try to be intimate with my wife, I feel afraid. Not because I don't love her, but because I fear seeing the disappointment in my own eyes." That's when I knew Michael didn't need a prescription. He needed a path. So I introduced him to something rarely discussed but incredibly effective when used correctly: the penile traction device. It's not about length, as many misunderstand. The true purpose of this device is to stimulate circulation, support vascular health, and improve erectile function. By wearing it for 1-2 hours daily over 3 to 6 months, it gradually improves blood flow, tissue response, and yes, in some cases even increases length. But this tool is for the patient and committed. It's not a magic fix, it's a process. Michael listened. We customized the device for his size and Comfort set realistic goals and tracked his progress. 6 months later, he returned, not heavy, but proud. He smiled and whispered to me what I consider one of the greatest compliments I've received. I feel like a husband again. Moments like that remind me that age isn't a sentence. It's an invitation to know and honor your body more deeply. And let me tell you something else. In medicine, especially when it comes to restoring male sexual function, there's no instant miracle. But there is one near-magical combination medication and physical therapy together. Men who use tadalafil or sildenafil alongside pelvic training vacuum therapy and traction devices see significantly better results. Not because the drug is stronger, but because the body is better prepared to respond. I tell my patients this pills alone won't fix what's been ignored for years. If your blood vessels are rigid, your pelvic muscles weak, and your heart and lungs sluggish, no pill can do the heavy lifting for you. And that's why I encourage every man to look beyond just function. Sexual health is cardiovascular health. It's neurological. It's emotional. It's whole body. I've seen men turn their lives around with something as simple as a brisk morning walk. I've seen dramatic improvements from reducing alcohol, quitting, smoking, sleeping better, and eating smarter. Even the small changes, a handful of berries, a few minutes of stretching, deep breathing in the sun, can lead to big shifts inside your body. Because when your blood moves, your body moves. When your mind is peaceful, your hormones respond. When your heart is open, your body listens. And that is where the fifth method comes in. My dear reader, I don't share all of this to preach or lecture. I share because I've seen it, because I care, because I deeply respect every man navigating the changes of aging without wanting to lose himself. You may have thought intimacy was something to keep quiet about a private struggle. But I want you to know those feelings, those desires, they are human. And as long as they exist, they deserve to be honored. I've met men who thought their best days were behind them until they returned to tell me how their wives cried tears of joy after their first intimate moment in months. Not from pleasure, but from reconnection, from a gentle touch, from the silent comfort of knowing you're still here with me. Sometimes it only takes a few minutes each day. A simple pelvic floor routine, a short vacuum session, quiet time with a traction device while reading the newspaper, a walk in the park instead of another hour on the couch, and when needed, a pill prescribed with care. These small acts, when done with purpose and belief, add up to something powerful, the return of confidence, energy, and the man you still are. I'll never forget the grateful eyes of Michael, of Edward, of so many husbands and fathers I've had the honor to help. They no longer felt left behind by time. Instead, they learned how to walk with it, actively, wisely, and joyfully. You can start today. You don't need much. Just one small decision to take care of yourself, not for anyone else, but because you deserve it. And if you feel like you need someone to walk this path with you, if you'd like a place to learn more about natural, evidence-based solutions for men's health at your age, then I'd be honored to continue guiding you. Subscribe to Seniors Live Healthy so we can keep having these conversations, so I can keep sharing tips, exercises, insights, and encouragement each week. I'm Dr. Esler, and I've spent 25 years helping men rediscover their strength and vitality. And I believe from the bottom of my heart, if your heart still beats with desire, your body with a little care will always know how to respond.